Welcome to Spaces, built by Bush Construction, a podcast that brings genuine conversations that opens minds to creative ideas in construction, design, and development. We'll share in-depth stories as an experienced commercial contractor and design firm, as well as our candid interviews with business leaders as it relates to the construction industry. So let's get started. Healthcare has had to jump through many hoops since early 2020. On today's episode, we have the privilege of chatting with Michael Patterson, President and CEO at Mississippi Valley Surgery Center in Davenport, Iowa. Being tasked with the leadership and direction of an ambulatory surgery center during a pandemic was an incredible challenge, a challenge that Michael very capably rose to. Listen as he shares new procedures to keep Mississippi Valley Surgery Center staff safe, ensure patients are comfortable being treated in their facility, and what changes are here to stay. Michael also shares about his military service, where he got his foundation in healthcare, and what his career path looked like. You'll be so glad you listened to this episode.
Thank you, Michael, for joining us today. It's a real honor to have you here, and we're looking forward to hearing some of your forward-looking and current perspectives on your industry. So tell us, maybe to set the stage for the listeners, tell us a little bit about Mississippi Valley Surgery Center and you and your role there.
Okay. Mississippi Valley Surgery Center has been around since 1996, founded by a group of physicians, and has grown exponentially over the last couple of decades into one of the preeminent surgery centers here in the Midwest. Currently the only advanced certified AAAHC orthopedic and spine ASC in the state, and really an excellent facility with a phenomenal staff and providers. I'm fortunate enough to be their president and CEO, and have been there. It'll be 9 years here in December. And have really enjoyed my role there, and continuing to look forward to what the future brings for us.
Hey, great. So tell me, so now we're in this COVID environment, and COVID has really turned things on its head for lots of folks. Give us just sort of an indication of what the coronavirus has done to Mississippi Valley Surgery Center, and maybe more specifically, what you are doing to counteract that or overcome the impact.
All right. So we have Mississippi Medical Plaza, which encompasses actually two surgery centers. We have an endoscopy center and a surgery center. Our endoscopy center, as a result of COVID, closed down for about 2 months. We didn't see patients. We closed. And the surgery center, we went to doing only urgent surgery, so maybe 2 half days a week. We were operating during that initial COVID response. And for things such as fractures or cancer type detection or treatment, any of those types of procedures we were still doing, but otherwise really kind of pared down what we were doing over that time. Some of the big issues initially, like everybody, was personal protective equipment, PPE, and getting access to that. Staff concerns about treating patients in a COVID environment. And how did we, manage that? Because we do have staff that take care of older adults and young children, and didn't want to contract something at work potentially and then take that home and have an issue. So we had to deal with that. So there was a lot going on at that time. Currently now, both facilities are open. We're running 5 days a week. We've taken a hit on our volumes because ultimately, we are a physician-driven facility, so patients have to go see a physician. They see the physician in concert with the patient tells them, hey, here's where we think we should go for this procedure. And patients are a little gun-shy yet to go into the physician offices. All of our practices have seen somewhat of a downturn, some more than others. And, we're responding to that in ways that are appropriate. But COVID has created both issues and opportunities in regards to healthcare and what we're doing to ensure we can continue to provide excellence in patient care.
This may be a lot of people see coronavirus impacts being long-term, some may be short-term. But tell me, as you look at this, is the impact in your business, do you believe that's more of a short-term impact based on the current environment, or is there some underlying long-term things that you think might be going on here with the utilization and the volume you spoke of?
I think, the initial, depends on what your short-term and long-term look is. I think this year, next year, we'll still have some impact. I think long-term, it's going to change the way we do business. Some of that could be for the better. given the fact that we are currently testing all of our patients at the surgery center prior to surgery, and if somebody's positive, we make them wait 30 days from when they were first tested. And so some patients are a little more comfortable now coming to a surgery center because we don't treat COVID positive patients that we know of. Now, we do some urgent add-on cases that maybe you come in with a fracture, you need that done. We do that at the end of the day, and we do full PPE for those cases because we can't get somebody tested and get a result back, but we know we need to get them taken care of. But virtually all of our scheduled elective surgeries, we know if a patient is either positive or negative, and we don't treat positive patients in those regards. Some patients will say, hey, I want to go to an outpatient facility that's like that versus a hospital where they obviously have to treat all comers and they may not necessarily know what's positive or negative coming through their doors. So that could have a positive effect on us. At the same time, I still think that patients are a little gun shy in going to the office, and you take a little more Motrin, you wait a little longer for that elective procedure, and I think that's showing in some of the volumes.
Are there other things? So you'd mentioned what you were doing for your staff and the facility and for your patients, and even like the COVID patients that you're treating at the end of the day if they're urgent. Is that something you're going to keep doing? Are there other things that you may keep for the long term because this is just good procedure now?
So we had the opportunity based on our current design of our facility, which was recently developed and built out by Bush Construction, and we have a beautiful facility now. We made a minor modification to our front, our waiting room area. Instead of patients coming directly into the waiting room now and just kind of standing there and checking in, we actually have a room off to the side that all patients, staff, providers, visitors, reps all come through there, and they all have to be screened for temperature and a questionnaire. And in patients, we actually take a pulse ox as well, just to check their pulse oximetry. And so that's something new that we're doing, and I don't foresee that changing in the near term or the long term, depending on how these things progress with COVID. So something new there in regards to screening of patients and staff. So I think that's important. And I think that will continue on as we work through this pandemic.
That's good. I really like that, the reassurance that you're giving your patients for that as well, and your staff, which is kind of nice. And on that note, do you guys do anything on the telehealth line or?
So it's a great question. In the true sense of telehealth, no. Telehealth is really you're on a device, your physician is on a device, or your mid-level provider. They're talking to you, having some dialogue back and forth around, basically a visit. We don't do that, but we are using some electronic communications, and we've really stepped up that opportunity here in the last 6 months. So we use one software where patients can go in and fill out all their health history online preoperatively. You used to come in, sit down with the health history nurse, she'd ask you a bunch of questions, she'd fill it all out on the computer for you, and we had, maybe a 20% utilization, and now we're well over 60% utilization now, where patients are doing almost all of that online. And then when COVID hit, and still we're seeing that grow to even bigger numbers because we don't allow visitors into the facility still. So that's another key point as well. We only allow the patient to come into the facility at this point. If you're a minor, obviously you get one parent that can come with you, or if you're an elderly patient that needs assistance of some sort, you can bring one provider with you, one person with you to do that, but we've limited all visitors now. Interestingly enough, since doing that, our patient satisfaction scores have gone up. And so we've asked the staff around, the team, what is that? Why do they think that is? And there's because we focus more time on the patient now. Yeah. We're not having to entertain the family and answering questions and doing these other things. We're purely focused on the patient, which has really been a positive, I think, in those regards. And then another bit of technology that we're using in those regards is, since you can't have a family member here with you, you do want to kind of know what's going on while your loved one is having surgery. And so we're using another program where the patient comes in, they can give a cell phone number to a family member, and then we give them updates as they progress through the facility. So after they get checked in, there's a text. After they go to pre-op, there's a text that says your family member is in pre-op. When the patient goes into the operating room, that family member gets a text saying they've now progressed into the operating suite. Once they're done with the operating suite and they go into the recovery room, They do that, you get a phase 1 text, and then shortly after that, the physician typically calls that family member and says, hey, here's what's going on, here's how the surgery went, and they have that kind of communication. So that's something new that we've implemented in the last 6 months due to COVID.
I love that. That's very nice. And the fact of, that the best of all worlds of giving that patient the undivided attention, but then keeping all the family members in the loop of the progress. I didn't even know there was such software. That's amazing.
Yeah. It's a program that we use that we use throughout the facility so that even our staff can see where patients are at, and the physicians, they can come in and they look at a board. We have these boards all over the place, and they can see exactly where patients are at in the process as they navigate through the facility and to their expected discharge.
Surgery can be so unnerving, so I feel, listening to you, that eases the fear of not only the patient, but also the patient's care provider of, I'm being taken care of, everything's going to be okay. How has your communication strategy been to let patients know that, while they're in surgery, this will be happening, notifications will be sent? I feel like that would be an important or value add to the service that you're providing.
Yeah. So when patients check in, we explain that process because we obviously have to worry about confidentiality and HIPAA. So if somebody doesn't want somebody to know, we just don't simply enter a phone number into there. So when we talk to them about letting family member or loved one know how they progress through, we explain it at that point. The other piece that, due to COVID, is we've had to do a lot more over the phone than in person. So sometimes the patients, they used to come in, they'd want to see the facility, they want to know what it's going to look like, where do they go? We don't do that anymore. So now our health history team is spending a lot more time on the phone, communicating, talking about expectations, talking about safety around COVID. We require all patients and or if they have a family member come with them to check them in, they have to wear face masks. They will be wearing face masks the whole time that they're in the facility. And so we explain the why. Not only are we here to protect you, but to protect our team, and we want to make sure that we're as safe as possible. So we go through all of that now. So it takes a little longer, but I think at the end of the day, we're still getting a better outcome from a patient education perspective.
Well, you kind of touched on this before a little bit, but in terms of the patient cancellation rates, do you anticipate, I know we were looking at the timeline of this year and potentially next year, is there a time frame in which you believe that uptick will increase? Is it through the end of the year, through the flu season? Any idea, or how do you benchmark, patients being okay with going back to the doctor and getting their procedures that they've kind of held off on? What is that threshold, do you think?
So typically, October, November, December are very busy months for us. And so this last quarter will be kind of the indicator of what things are going to look like. If we see that uptick, that'll make me feel better about where things are heading. But if we stay relatively flat, I think that'll also be the indicator that we're not seeing this huge rush to get elective procedures done. Currently, as it stands, we're about midway through from some scheduling of. It's not been like this, rush of patients here at the end of the year, but rather patients that maybe held off about as long as they can hold off, and then they want to, want to schedule their surgery before the end of the year. We're kind of waiting to see. It's a wait and see approach on that and being responsive to those needs, which can be a challenge from a volume perspective. You could go from having 10 patients one day to having 40 patients the next day. And staffing for that is always a challenge, and trying to support staff that, would like to take a full-time paycheck home. And that sometimes is not always possible with these huge swings in volumes, depending on what goes in to see the physicians in their offices. The other thing are specialties. Which specialties that, if you're thinking about ENT, which is all up here in respiratory, that they've probably taken the largest hit. There's some procedures that, maybe patients are just putting off because of, dealing with that. And then our providers actually weren't doing any sinus surgery for quite some time just because of the increased risk of COVID. So I think a lot of it is just dependent upon the specialty and whatever type of particular issue you might have going on, and whether or not that's going to continue to come back or not. So right now, I don't think myself or anyone really knows that.
Mm-hmm. What specialties do you have at Mississippi Valley Surgery Center?
So we have several. We have orthopedics, ENT, gastroenterology, pain, ophthalmology, cataract surgeries, plastic surgery, GYN, general surgery. We run retinal surgery. We run the full gamut. There's maybe only one or two that we don't do anything with, but otherwise, for the most part, we do just about everything.
I'm curious, you said October, November, December are your busy months. Does that have anything to do with any sort of outside things, or is it mostly insurance and end of the year driven type stuff?
Insurance end of the year driven.
Not ice or snow or snow skiing?
No.
We worked with you with a couple of projects over the past few years here. What was driving those innovations and those renovations, and kind of what's driving future trends and kind of what's next?
So, as I stated previously, the facility was opened in 1996, and healthcare has changed drastically. We had, wide open, open bay areas, and so we wanted to look at finding a more private and confidential space for all of our patients, both preoperatively and postoperatively. I think technologies in both surgical technology as well as pharmacological technologies have advanced to allow us to do what I would say was more complex cases that normally would have required a couple of days stay in the hospital that you can go home same day or overnight. And we wanted to be prepared for that because we see that as continuing to transition from the hospital setting to an outpatient setting. For example, we've been doing total joint procedures for over 15 years now, and sending patients home the next day with just a 23-hour stay. And now, a lot of times, patients will go home same day. And so there's that. And then there's spine. Who would have thought that you would get your spine operated on and be able to go home the same day or the next day? And I think the next significant opportunity of that transition from the traditional hospital setting to an outpatient setting will be cardiology. We're seeing that on some of the coasts where there's freestanding independent cardiac cath labs and endovascular labs. And in fact, within our complex, not as part of the surgery center, but part of our complex, there is a cardiologist there that has a full-blown cath lab. It's called an office-based lab, an OBL. And he does endovascular work there in his office because he feels that outpatient is the way to go and send patients home, and thinks that patients recover just as well, if not better, at home, surrounded by familiar surroundings than in a hospital where sometimes you don't get the greatest sleep, and you run the risk of what's called a nosocomial infection. And so I think that we'll continue to see this trend of traditional hospital care transition out of those traditional settings into outpatient settings. And so we wanted to be prepared for that for the next 10 or 20 years. And so we built our recovery care center that allowed for those overnight stays, and went to an all private room setup, expanded some of our area operations, our CPD department, and then really wanted to get efficient about staff flow, patient flow. And we had a divided area with ORs on two sides of the building, which wasn't really efficient, and so we put them all together in one area, and it's really worked well.
One thing we talked a lot about and saw in kind of multiple industries was how quickly people changed and innovated when COVID first hit. What was the biggest surprise that you were the quickest innovation you saw in the time frame that it took to make that happen?
So that's a great question. I think that one is really understanding how do we continue to get patients through the system and get the care that they need while trying to protect our healthcare resources, i.e. our staff and providers. And so I think with screenings and masks and face shields and all the things that went around with that, we had lots of people thinking about how do we do this to just make healthcare safer, because people still need to access the system. I think that was pretty remarkable. And then when you think about now even testing, we're looking forward to what's called a point-of-care test, where somebody comes in and you take a small sample of either breathing or blood or some sort of opportunity there where we can get a test result immediately, versus having to have somebody go have a blood drawn or a nasal swab, and then you got to wait 3 days for the result, which is still good. But I think that point-of-care testing and getting that developed will also be a game changer for us, because that changes things considerably.
Michael, earlier you mentioned how the how the hospitals, they must take patients for surgeries, and they can't be a little bit more selective like an ambulatory surgical center like you can in the event maybe someone has coronavirus. While there's still such fear around that virus, you can say, hey, we're going to hold off for right now. So that makes a ton of sense where maybe some more of the surgeries would happen in the hospitals. But I've heard recently there's been a shift of people coming into the ambulatory surgical centers, the ASCs, wanting more of their surgeries done. You mentioned a few of those things. You can do a total joint replacement in a 23.5-hour period. Cardio work you can have done at an outpatient facility also. But tell me, why are the hospitals doing this? Why is it that the ASC is seeing an increased level of business, maybe that would otherwise have been done in the hospital environment in years past?
I think one is convenience. If you look at our facility in particular, you can pull up and you're about 20 steps from the front door. You don't have to navigate through a massive hospital system to try and find where you're going and what you're doing. And don't get me wrong, we all need hospitals. They're vital to the nation's healthcare. They are there when we need them. They provide 24/7 services, and we're fortunate to have the healthcare system that we do in this country. I just think that site of service is going to change from you got to be really sick or you need a very specialized service. You need brain surgery. And by the way, there are ASCs that are doing neurosurgery and sending patients home in 23 hours. And so that is actually occurring on the East Coast. There's a couple of facilities out there that are doing that. And I think that you will just see the convenience. And then we do have to address cost. So surgery centers get paid 50 cents on the dollar to do the same procedure that a hospital does from Medicare. And I think at some point you have to recognize that if we can do the same procedure, have the same outcome, but we can do it at half the cost, why aren't we transitioning more of that business into these facilities? Because we're going to go broke as a nation trying to pay for healthcare. And if there's a solution that's there and available and has the same or better quality outcomes, we should be utilizing that. And so I think some of that all together, there's some recent studies out around how many billions of dollars the ASC industry is saving or will save Medicare over the next several years. So it's quite interesting. It's fascinating stuff.
That is really fascinating. So I was baffled by the fact that a heart surgery could happen in an ASC, but then you said a brain surgery could happen as well. Is there anything sort of off limits? Is there anything an ASC can't do at this point from a surgery perspective?
So the one thing I have not heard of is an ASC doing births. So, but now you can do that at home if you want. But it's not a surgical procedure, and unless you obviously have to have a C-section. But I think currently at this point we haven't seen, and there's been no predictions that I'm aware of transitioning that out of the traditional hospital setting. But there's a lot of stuff that is going on in healthcare that is transitioning to outpatient facilities, and it's a great time to be in healthcare.
We were talking before you got here a little bit about your role and all of the departments that you have to manage, and now you just even mentioned more than we knew that you offered at your surgery center. So I wanted to know a little bit about what your background is. And I know that we've chatted before about your military service. And if you could tell us a little bit about that and maybe a fun story or two, and then how that career progression moved you to where you're at right now.
Okay. So I was fortunate. I joined the military right out of high school and was in an amphibious assault unit stationed in Coronado, California. I got the opportunity to see the world, as they say. And from there, I was fortunate to have good mentors and the ability to get selected for a program within the Navy that allowed me to go to college, have the Navy help me pay for that, take a commission as an officer, and then come back on active duty. So I picked nursing as my healthcare choice. My mom's a nurse, several aunts that are nurses. I had been an EMT and really looked at healthcare as a great field. So I took that opportunity and then was, given my emergency background, was immediately put into the emergency department in my first duty station. And then the Navy at the time had some relationships with a couple of trauma centers. So I did my trauma nurse specialist at Cook County Hospital, the old Cook County Hospital. And so learned a lot of great healthcare learning that goes on in Cook County. And so that allowed me the ability to then travel the world and treat patients with both blunt and penetrating trauma. did my share of deployment, and was fortunate to come home from those and treat a lot of injured service members, and did some flights back and forth from overseas back to Walter Reed or to another facility in Texas. And I think that, that time allowed me to really understand what I was doing. In the Navy, you're an officer first and you're a nurse second. And so you really got to understand your leadership principles. And so that allowed me the opportunity to learn into these roles, and had a few folks that recognized the potential and took me under their wings, guided me. And then when I came out of the civilian sector, I worked my way through a couple of different positions that allowed me to get a nice, solid background in multiple healthcare settings, and ultimately led me to where I'm at now.
Which explains why you have such a well-rounded view on where Mississippi Valley Surgery Center is going to go. Like, that's a lot of good foundation. And since you are ridiculously busy, we are curious to know, what do you do when you're not working or at a business dinner or speaking engagement? Like, what is just for fun?
So fun for me is my bike. I'm an avid bike rider, Peloton. When the weather here in Iowa doesn't allow the outdoor biking, Peloton, hiking, and I like to spend a lot of time. I have a daughter who's 9, and seeing the world through her eyes is fascinating to me, and letting her explore, and so we spend a lot of time together doing that kind of stuff. So that probably consumes the bulk of my time when I'm not at work or doing things associated with either the ASC industry, the physician practices, or our related entities.
That's great. Good stress relieving activities.
Yes.
And I'm dying to get a Peloton bike. So
they're amazing.
Yeah. Thank you so much, Michael. I appreciate you taking time out of your day and spending that with us.
Thank you for asking me. I appreciate it.